Medical spas are basically an amalgam of medical care and typical spa treatments. They're usually administered in name only, or sometimes very practically on a day-to-day basis by a physician, and they provide a variety of services in addition to the standard kind of treatments you would expect in a spa, massage, etc. They provide a whole host of other entities or procedures from fillers, Botox, all kinds of injections, chemical peels, things that are often administered in the real world by non-physicians, but by qualified, hopefully, aesthetists, nurse anesthetists, etc. I think it's a variety of reasons. One is with furloughing reimbursements, doctors are looking to provide treatments and care that are not subject to the very limited insurance payments that are the rule today. It also enables patients to uh, get medical care, if you will, without having to face the anxiety of going to see a physician, so-called white coat anxiety. And I think that those are the two primary motivating factors. Well, there's a number of them, and I think that the most prominent one is care being rendered by and procedures being performed by people who are not licensed or trained to perform the specific procedure. There have been some well-publicized horror stories uh, about such a thing. And the other major concern is that in the event that one of these medical procedures, if you will, goes suddenly wrong, there isn't necessarily a physician on site to handle the emergency. There are a number of liability concerns that have to be faced if one is to open and run a medical spa, a medi spa, so-called. It's really important that everybody working in the spa be licensed and qualified to perform the procedures that they're performing. Uh, Adequate medical supervision has to be available. Now, the rules about this are right now fuzzy in New York State, but a physician should be available. The other major issue is that anybody providing care has to have malpractice insurance for what they're performing, whatever their specialty. We've seen many situations where care is provided by a non-physician, and when a suit is filed, it's discovered that the non-physician, in fact, has no medical malpractice insurance. So who do they come after? They come after the physician who owns the med spa. Uh, the other major concern is that things are performed without proper informed consent. And you really need to have informed consent for things that have become very pedestrian in nature to the general public. Botox injections, fillers, chemical peels, uh, trigger point injections, etc. They all need to have adequate informed consent, obviously discussing the possible complications that are involved. The main point being that the physician who owns or is in charge of the medical spa is going to be on the hook for an adverse outcome, whether or not there's any liability. And those are the major areas that a plaintiff's attorney is going to look at first when deciding whether to accept a case. Right now, there's a little bit of a Wild West feeling about the whole issue. In some areas, med spas are quite popular. In Manhattan, where I live, on the East Side, they're everywhere. They're everywhere. And people will stop in and have their procedure done, and with a informality or casualness that sometimes is not in keeping with the potential seriousness of the procedure being performed. One has to go back to the basis. One has to go back to the basis. Most of these treatments that are provided are not being performed by the physician. So you have to check on the training of the people you hire or who come into the facility to perform these treatments. They have to be certified by their specialty. As I mentioned earlier, they have to have insurance, malpractice insurance for what they're performing. These are all really critical critical issues. A crime, the typical background for previous crimes. These are employees like any others and have to be thoroughly vetted. Thoroughly vetted. Well, they're designed as basically as, in my opinion, of profit-making entities. Um, there's definitely an interest on both sides in seeing the treatments being provided as being quote unquote not serious. Um, the patients like to see it that way by way of mitigating their risks. The doctors like to see it that way so that they can delegate these procedures to less formally trained necessarily people. So there's a common interest in seeing these entities and the things that go on in them as being less serious. But anybody who's been working in the field of medical malpractice knows that um, bad things can happen anywhere, and people need to be certified, trained, and there has to be some provision if things do go wrong, because unfortunately they do. We all know that.